just checking their audio. Okay, good. Okay. So, like I said, I'm Mandy Wright, State Representative to the 85th Assembly District. Thank you very much for coming. We are here to celebrate the release of a new resource for our ongoing battle and collaboration in making sure that we address alcohol and other drug use in Marathon County. This new resource is Wisconsin's Heroin Epidemic, Strategies and Solutions. It's an analysis and recommendations for reducing heroin abuse in Wisconsin. And it was just released by the Wisconsin State Council on Alcohol and Other Drug Abuse. It's my privilege to introduce a panel of experts on this issue. And they will give you much more information about this much needed tool that we can use to address heroin abuse. So first of all, we have Deputy Administrator Deb Hager of Marathon County. We also have Assistant District Attorney Lance Leonard, Deb Piscoti of Peaceful Solutions Counseling, and Melissa Dotter, Drug Free Communities Program Director for Marathon County. Thank you.
Thank you, Representative Wright. As Representative Wright said, I'm Deb Hager, Deputy County Administrator for Marathon County. One of my primary tasks is to be the lead staff support to the criminal justice system. And so I'm going to talk a little bit about the local impact that we have seen as a result of the increased heroin use and drug and alcohol use in Marathon County. About 6 months ago, County Administrator Carger asked me to really check into what was the impact of heroin use within Marathon County. He says, I keep hearing about this heroin epidemic. What does that really mean for Marathon County? And as I was reading the report, which is very reflective of what Marathon County's experience has been, and also is very consistent with some of the things we are exploring to respond to and address the issue, I want to highlight just a couple of things that I think are important. And the first is that the number of overdoses increased from 2012 to 2013 by 217%. Now, number-wise, that is not, we're not talking like 50 to 100, but it's still doubled in a 12-month period of time, and that is significant. Second, in our criminal justice system, I had our jail administration run a report for 2013, and we had 560 people incarcerated and charged with a drug-related crime in 2013. Those 560 persons spent over 40,000 days in jail. If you take that at $50 a day in jail, it was well over $2 million just in drug-related crime incarceration. That doesn't include the court time for prosecution. It doesn't include the DA's office, anything else other than just being in jail. That's a significant amount of money that could have been directed to other opportunities that we just don't have available to us. And those are all local county dollars that we're talking about. The third piece that showed up in the report that I think is important is the impact that it has on children. As the county, we are responsible for the protection of children who are in abuse and neglect cases, and also kids who, because of behaviors, wind up needing to be placed out of county or out of their homes. And we had out-of-home placements through social services. In 2013, there were 55 children who were placed out of home due to drug and alcohol related issues. The total annual cost of these placements were $437,000 in 2013. This, again, does not include the social workers' case management costs. It doesn't include legal costs. It doesn't include any kind of court costs. This was just services that we provided to these 55 children that we needed to place out of the home because of abuse and neglect, substantiated abuse and neglect cases. We also had 16 juveniles that we placed out of home due to alcohol and drug-related issues in 2013. The total cost of these placements were over $950,000 in 2013. Again, these costs do not include the social worker costs, treatment costs, or other service provider costs. Marathon County, we were able to tally, spent well over $5 million last year reacting to drug-related situations, whether it was in the courts, whether it was in the jail, whether it was in treatment for detox, or in placement of kids who either because of their own behavior or abuse and neglect were placed outside of the home. This is the tip of the iceberg. It did not cover any of the legal system costs, any of the outpatient treatment costs. This was just what we could specifically identify. So you need to understand that we're putting an awful lot of resources into this situation, and it's having, I think, as I was talking with the assistant district attorney, minimal impact at this point. And one of the exciting things about the report is that it does speak to several areas that in my 7 years of working in this field, I totally support and agree with. The first is we have to reduce childhood trauma, early childhood trauma. The folks that we are incarcerated for drug-related crime, who are in our OWI courts, the common denominator they have is that they've had some significant early childhood trauma, and we've got to address that. We've got to become better at that. We will never stop this flow without it. Second, we are actively seeking and looking at how we can create a drug treatment court that models what we have done with OWI treatment court very successfully. I am also in conversation with the social services director about a family drug court, which looks at how do you address people who have drug issues and also are involved in abuse and neglect of their children. We also have the Sheriff's Department actively involved in creating a drug endangered child network here within Marathon County. That's essential, again, to addressing the needs of kids who are impacted by abuse and neglect as a result of parents who use and abuse drugs. And the fourth piece is we have to expand access to appropriate mental health treatment and drug addiction treatment for offender populations. And this includes wraparound services upon discharge from residential facilities, as well as support services for drug-free, safe housing, employment, and access to health care. We can't enforce our way out of this. It's going to require a much more complex strategy, and that's one thing that I think this report really does, is looks at, there's not a one-size-fits-all answer. It's going to require multiple efforts in multiple ways.
Good morning. My name is Lance Leonard. I'm a prosecutor in the Marathon County DA's office. I've been there almost 8 years. At this point, my primary duty is the prosecution of felony drug trafficking offenses, and I was really happy and pleased to participate in the drafting and preparation of the report that we're talking about here today. And as Randy Wright said, and as Deb indicated, this report really does provide a comprehensive strategy for communities to deal with this heroin epidemic that both the counties have been dealing with and really law enforcement has been dealing with for some time. and I was asked by Melissa today to talk about the impact it's had, this heroin epidemic, on law enforcement specifically. And I don't think it can be overstated. The impact is at all stages of the criminal justice system, beginning with law enforcement. I think, as Deb alluded to, the correlation between substance abuse or addiction and criminal activity can't be overstated. She talked about the jail bed numbers and the costs. Recently, Chief Hardell from the Wausau Police Department gave a statement at a press conference that he estimated 75% of the calls for service that his department responded to were in some way correlated with substance abuse or addiction. We've seen a surge not only in traditional drug cases, but also we've seen a surge in what I like to call collateral drug cases, which involve your property crimes, your thefts, burglaries, robberies. Our community has really seen a dramatic increase in those types of offenses that can be traced directly back to filling that addiction, that need for that controlled substance. Another area where law enforcement has seen a significant increase is in drug driving cases. The reality is that drug users, drug abusers, particularly those using heroin, pose a significant risk to the community when they operate a motor vehicle. Our community has really borne witness to that on numerous occasions. Law enforcement has responded in kind with this report. One of the recommendations is for the increased use of drug recognition experts, and law enforcement in this area has been doing that for some time. The problem, however, is that training is very expensive and it's very time-consuming. The report that was prepared and is available to you today talks about that, and one of the recommendations relates to giving communities some way to defray that cost and increase the number of drug recognition experts that people can deploy on the road to do interdiction, to basically recognize that behavior and attempt to prevent significant harm to the community, and I think that's very important. As Deb talked about also, there's a significant correlation between heroin addiction or drug addiction and the incidence of drug-endangered children. Well, one of the recommendations in this report is to increase training to law enforcement in that recognition, the ability to intervene in an investigation and recognize drug-endangered children and take the requisite steps to ensure that that's dealt with appropriately. Crucial to law enforcement investigations, oftentimes we, as prosecutors, have to rely upon the local crime laboratories in the state of Wisconsin for evidence processing, and I think the numbers that are set forth in this report really do give a stark look into the dramatic impact the heroin epidemic has had on those laboratories. Between 2006 and 2011, the crime lab saw an increase of 350% in the number of heroin samples that were submitted for testing. And that's really powerful when you consider the fact that far from every sample that's obtained by law enforcement or every suspected heroin sample is sent to the crime lab for actual testing. Similar increases have been made to the state hygiene lab, which, unlike the crime lab, which deals primarily with the testing of drugs, the hygiene lab tests blood samples for both alcohol and drugs. And the reality is at this point, based on the dramatic increase in the volume of samples submitted for testing, prosecutors are often waiting up to 9 months or longer for those drug test results on those blood samples. The report that's available today, one of the recommendations that it makes is basically the creation of a task force between the crime laboratory and the state laboratory responsible for blood testing, as well as state representatives, to look for cost-saving means to basically reduce that backlog. Because everyone recognizes that the timely administration of justice is really a necessity for law enforcement, because if that's denied, basically what we have is an individual that poses a risk to society remaining in the community when a timely intervention might defray some of that risk. In terms of prosecution, again, I think the impact on our community and the impact statewide is pretty dramatic. Between 2007 and 2013 here in Marathon County, we had a 700% increase in the number of heroin cases. I think that's staggering, but as Deb alluded to, one thing we've seen through the medical examiner's office is a dramatic increase in the number of overdoses, fatal overdoses, as well as near fatal overdose cases. Those cases were, some time ago, exceedingly rare. We went many years without even initiating a prosecution. The reality is at this time, those cases are relatively commonplace. I handle a great many of them. In fact, this week on Tuesday, I participated in the sentencing of an individual convicted for first-degree reckless homicide in connection with a heroin overdose death. So the burden when you look at not only traditional drug cases, but these overdose death cases on prosecutors and DA's offices across the state is significant. And Marathon County has reacted in a way that I think that's positive, that seeks to deal with that, and that is it's devoted a full-time prosecutor to those cases. That's been my job for almost the last 2 years. At the same time, I think there are still some things we need to do as a county and a state to continue to address this problem for prosecutors. And one of the recommendations in the report relates directly to staffing. At this time in the state of Wisconsin, DA's offices across the state are staffed at 69% of what is estimated as a full-time staffing need. The recommendation in the report is to rectify that by increasing the number of prosecutors, but also providing specific training relating to the prosecution of traditional drug cases as well as these heroin overdose or reckless homicide cases. Because the reality is in those prosecutions you're dealing with very complex issues. You're dealing with toxicology experts, forensic pathologists, and you're dealing with a lot of witnesses related to the identification of drugs. So those cases are difficult from a prosecution standpoint, and the report recognizes that and recommends dealing with that in an effective way. Finally, the reality I think everyone understands is that at the end of the day in the criminal justice system, we need to talk about corrections and the approach to dealing with individuals with drug abuse and addiction needs. And the report goes through in great detail some of the recommendations that are needed, and that report is available, but quite simply it takes a meaningful look at the need to provide some form of treatment, a variety of forms of treatment, to individuals who are incarcerated both in county jails and in the state prisons. One of, I think, the real innovative recommendations is the use of pilot programs for county jails around the state, the use of Vivitrol, a narcotic blocker for those individuals who are making that transition from community jail or prison incarceration to the community. So at this point, I really think the administration in Marathon County is moving in the right direction. I think the state is as well. And if the other recommendations set forth in this report are followed, I really do think we can start to make more of an impact, as Deb alluded to, into this growing problem. Thank you.
Good morning. I'm Deb Piscotti, and I am the Substance Abuse Clinical Supervisor for Peaceful Solutions Counseling. Melissa asked me to come and talk a little bit about the treatment pillar portion of the report that just was released. The fact is that, I was thinking a lot about my work that I do, not only in a past position, but, in my current position. And the reality is that opiate addiction issues, such as IV heroin use, continue to be an ongoing issue for our community and the state. As well, we see our young people that are getting caught up in the grasp of the monster that we call heroin, and too many people are dying as a result of addiction. So I took some time and was thinking about the work that I'm doing right now with the adolescents in the Choices group. And what do I see? I see kids that are 12 years old that are actively using alcohol and marijuana. I see kids that are 13 years old that are already experimenting with substances like IV meth. I see kids that are as young as 14 years old that are already addicted to potentially lethal drugs. If this shocks or scares people, well, it should. There's no disputing that we have a treatment crisis, especially when it comes to our teens and young adults. These are children, and they need help. Some people may turn a deaf ear and may think to themselves, well, this isn't my problem. Well, the fact is that it's everyone's problem. I think that was alluded to already with some of the conversation that Deb just had regarding the financial impact on our community, let alone, the personal impact. I think to myself, I've been working with a lot of people, a lot of parents that have said, I've done all the right things. Their kids were involved in church and sports and other extracurricular activities, and yet those same kids fell into addiction. We can't think about this as someone else's problem. For all you know, it could be your child or your grandchild that's next. So with here's what we have to do to meet the ever-growing needs, treatment needs of our young adults and our teens in the state and in our community. The first thing we looked at was adolescent treatment services. We need them expanded throughout the state because there are a lot of places that have limited or no access to treatment especially for adolescents. We need to establish inpatient detox centers throughout the state to make it more accessible for rural areas, because one of the things I think about is Wausau. We really have nothing, and the nearest is Green Bay or Eau Claire in those areas, and that's an hour and a half away, which really impedes a family's ability to have involvement in that adolescent's treatment. We need to increase the access to treatment options for those people that are in the judicial system, not just the people that are out. We need to increase support services for our pregnant women and postpartum as well. And another piece that I think plays into what Lance was talking about, we need to have access to Narcan. Because although we have a lot of overdoses that are reported, there are multiple times more that are not reported, and it's because of the life-saving value of Narcan. It really does save lives. So, thinking about all these, the fact is that, even though, I look at all the recommendations that have gone on, and these were the recommendations to the state of Wisconsin, we need support to make them a reality. The fact is that opiate treatment it's not a one-size-fits-all, and we don't all come in bunches like grapes. What one treatment option may work for one person, but it may not work for another. So we need to have multiple avenues for treatment. I think about the multiple roads to recovery, and it's the same venue. So I'm putting out a call to action. That's one of the things we talked about, Melissa and I. Putting out a call to action to our community and to our state. Supporting the idea of these recommendations. It's nice, but it's not enough. We need to have people that are investing in and providing the opportunities to expand these treatment programs. Thank you.
Thank you to my fellow panelists and for all of you for being here today. Our community's concerns over heroin and opiate abuse are not unlike other counties within our state. We know that heroin, prescription medications, and illicit drug use continue to be a threat to our public health and safety. We know that funding for prevention, treatment, and enforcement is critical because one agency can't do it alone. And we know that in order to make a difference, we all need to be part of the solution. After all, we're all impacted by the burden of alcohol and other drugs on our community. It was Margaret Mead, famed anthropologist, that once said, "Never doubt a small group of dedicated and concerned citizens can change the world." Indeed, it's the only thing that ever has. I'm here to tell you today that there is hope. When we kicked off the Pushback Against Drug Abuse initiative in May of 2013, we knew we had a tough road ahead of us. With the help of Kinsey Green Marketing Group, the Judd S. Alexander Foundation, and the AOD Partnership's many community partners, we've made fantastic strides in our response to address the scourge of heroin. By engaging a diverse group of individuals and organizations in our efforts, we're able to move the needle towards a safer, healthier community. In just over 15 months, we've seen drug-related calls to our local Crime Stoppers line go up over 230%, from around 39 in the year prior to the 2013 launch up to 89. Community concern over illicit and prescription drug abuse also has increased, more than doubled since 2011, with more and more people making that link between the gateway of prescription drug abuse into future heroin use. To date, over 6 tons of medications have been safely disposed of at our medication drop boxes throughout the county, with about a third of those consisting of commonly abused medications such as prescription painkillers. Coalition involvement has increased over 30%, in not only our weekly update or electronic newsletter recipients, but in our coalition meetings, in our trainings, in our volunteer events. Neighborhood engagement has gone up as well, with over 3,000 pushback bags delivered to date. Those bags contain information like how to identify drug activity and how to report it, how to identify possible drug use and how to intervene, as well as ways to get involved with our coalition and neighborhood efforts. Without the support of our many community partners, coalition stakeholders, local funders, policymakers, media, and numerous other individuals that I'm going to end up missing if I try to list them all, we'd never be as successful as we have been in raising awareness and engaging the community. Another key partner that we need to thank is the State Council on Alcohol and Other Drug Abuse, or SCAODA. Many of our previous successes are due in part to the guidance that they've provided over the years through their various reports, whether it's on medication abuse, on alcohol culture and environment, 911 Good Samaritan laws, or the use of consistent screening tools for addiction, such as the SBIRT. I was humbled, just like with Lance and Deb, to be a part of this newest report on heroin specifically, and to be able to work side by side with the foremost experts in the state, working to address heroin on a 5-pillar approach. By engaging prevention, treatment, enforcement, harm reduction in business sectors, we are more effectively and more efficiently be able to make the use of the dwindling resources and the increased demands on achieving the much needed outcomes on this complex issue. I truly believe that this report will not only help our community, but communities throughout Wisconsin. It may seem that we're fighting an uphill battle, but I can tell you that the battle is not lost. We are going to need each and every one of you to continue this march and to fight on. For we are at a critical time in the future of the AOD partnership and our local prevention efforts. The writing's on the wall. We need more in the areas of prevention. We need to invest in stopping people before they make that choice. These are not bad people. These are our families. These are our kids. These are our siblings. These are our neighbors. These are our friends who made this decision. Addiction does not discriminate. We can't fool ourselves. The drugs of first use are usually those that are readily available. As Deb said, when it comes to tobacco, alcohol, marijuana, prescription medications, we need to do whatever we can to stop that first decision. We need to instill the protective factors that will eliminate or delay our teens and young adults from starting down that path. Yes, we've made strides, but our goal is to continue this conversation coming up on Friday, September 26th from 8 to 10 in the beautiful Aspirus Medication Education Center. We're going to be holding an opiate summit where we will bring together our coalition partners, policymakers, media, state representatives, funders, and anybody else that is interested in how we can continue to move that needle on heroin and opiate abuse. The recommendations within that report, as well as those found through that summit, we hope will build upon some of the legislation that was passed last year. Marathon County needs to continue to invest in prevention, treatment, and enforcement efforts to keep us moving forward as a leader in the state. To take a line from Dr. Seuss's The Lorax, unless someone like you cares an awful lot, nothing is going to get better. It's not. There is hope. Prevention works, treatment is effective, people recover. I thank you for your attention and commitment to this initiative. Hard copies of the report are available not only on the SCAODA website, but also on aodpartnership.org under our resources tab. At this point, I will open it up to questions.
Question for Deb about the detox. The healthcare center's got detox for alcohol, right?
I believe so.
But not for drugs?
You know, I'm not 100%. I know that there has been
She
some,
might have the answer to that.
Yeah.
cool,
They,
wonderful.
they do detox for drugs as well. However, they only detox adults. And I think that's part of what Deb was
Right.
talking about, was the lack of detoxification services for youth. And I think that's a huge gap. And I will tell you that North Central Healthcare has been at capacity oftentimes with their detox unit, and it has resulted in us needing to seek outside of area detoxification just because of that. So basically, the need even with adults is exceeding their capacity.
Any other questions? Okay, well, if you want individual interviews, oh, you have a question.
You mentioned the 5 pillars and one of them being business. What's the business role? What do you see them doing?
Well, included in the report, there's a number of recommendations that go beyond businesses having things like health fairs or having EAP programs. Because some of the times you think, well, we have an EAP program, it's available. But when you're looking at supporting someone that is in recovery, for example, that having the access to the ability to be able to either have recovery groups opportunities on site or being able to go and take part in these recovery groups is something that's recommended. As well as looking at what is regularly referred to as banning the box. A lot of the times those that have previous drug addiction issues have some sort of felony on their record, so automatically their application will be thrown out. So they may be years sober, but they still don't qualify for good paying jobs in our community. So that's just a couple of the recommendations, and I think that it does help
Do you
to engage.
want employers to be more open-minded with possibly hiring a felon?
I think that it's just like addiction, it's person specific, to look beyond just the fact that that box was checked, to be able to interview that individual and see the person for who they are, not what they've done.
Is there any move to have, like, you need to check the box if you've been convicted of a felony within the last 10 or 15 years? I mean, I know a guy who had a low-level felony like 24 years ago, he can't get a job at Burger King. Is there any move to say, after a period of time when you're not engaged in felonious behavior, you don't have to check the box?
I know that other states have passed ban the box, and just like Melissa said, I don't know off the top of my head which states they are, but it's simply not on the cover sheet of the application. So employers are still expected to do background checks and find out that information, but the idea is that you look deeper into the person before you just immediately toss out that application because the box was checked.
The only thing I will add in working on the report is that the business pillar really was a lot about education for businesses. It's talking about developing a policy, the EAP programs like Melissa said, and also education regarding looking at the individual applicants for work, because a lot of times, like Melissa said, that application goes in the wastebasket as opposed to receiving meaningful review by an employer, and really that's a disservice not only to the person applying but very likely to the business itself. So the workplace pillar, like all the other pillars, is really a lot about education as well as making recommendations based on data that's been received in a great many other communities, so that effective intervention and treatment as well as workplace policies can be put in place.
Did you have a question?
I think this is a question for Deb. You mentioned earlier some of the hidden costs of this with regards to children involved in, houses where drug activity has occurred. How's the foster care paid for? Is that through county budgets? Is that through state budgets?
It's paid through taxpayer dollars, a combination of both state and local dollars. So yes, again, in order to ensure the protection of these kids, it is our responsibility as a county government to provide that protection where it's needed and to make sure that children are in safe environments and to pay for that care.
And then the drug counseling care and stuff that you talked about earlier, is that actually a part of that budget?
For those juveniles who have drug behaviors, yes. For individuals who are adults, we're looking at the public mental health community pretty much, which would be North Central Healthcare in our area, which serves as that agency. And again, those are, again, publicly funded dollars that go to support those treatment options.
Thank you.
Any other questions? Well, thank you for coming. Our panelists will be available for any follow-up one-on-one questions after. There's plenty of materials, copies of not only the heroin report, but some of the previous reports, including one on prescription drug abuse specifically, and one on the screening brief intervention referral tool. So thank you everybody for coming. Have a great afternoon.